Okay, we're with Arsene from St John's Ambulance. You're going to show me how to do CPR.
Yes. So before we do CPR, we need to make sure to do a list of things to make sure that CPR is exactly what we need to do and that it's safe to do it. So we use an acronym called Dr. HABC, and every letter stands for something you do before you start CPR. So
Dr. H.
Dr. HABC.
ABC.
Yeah, so D stands for danger. You need to check for danger. If it's safe to approach the casualty, the worst thing you can do is become a casualty yourself, so you need to make sure that it's safe to treat the patient. Then R is response. You would approach the casualty from the feet and speak clearly and loudly into both of their ears. Say quick, simple things like, "Hello, my name is Arsene, I'm from the ambulance. Could you open your eyes for me, please?" If they don't respond to that, you check for if they respond to pain by kind of gently nudging their shoulders. If they don't respond to that, H, you move on to H, which is shout for help. And you let others know that this is a situation that's going on. And then you check their airways, because you're not sure, they might have choked on something and their airways blocked. For that, you just open their mouth and you see if there's anything stuck in there. If it's open, then you check for breathing. What you want to do is tilt the head all the way back, open their mouth, and put your cheek next to their mouth so that you would feel their breathing on your cheek, you would hear it in your ear, and you would see their chest rising and falling. You're looking for about 2 breaths in 10 seconds. Anything below that, you need to start CPR.
Okay.
So C can stand for CPR. It can also stand for circulation. If they are breathing, you would need to check that they're not bleeding out, essentially, because not breathing will kill them first.
Yes.
So say they're not breathing, you would need to start CPR. So there are many ways to do it. The way we teach it in St. John is you take whichever hand you prefer, usually your dominant hand, you straighten it out, you grab it with your other hand, and you use the heel of your hand to compress on the middle of their chest, in the middle of the nipple line, using your whole chest weight, not just your hands. So you do about 30 compressions before moving on to rescue breaths. To do rescue breaths, you pinch their nose, you tilt their head all the way back, open their mouth, and create a tight seal between your mouths. And you just exhale normally as if you were about to speak, not your whole lung capacity. So you do 30 compressions at about 100 to 120 beats per minute. That equates to some songs like Staying Alive, for example. Yeah, so it's an easy way to remember. So you would do 30 compressions at a regular speed, and then rescue breaths. You continue doing that cycle until a defibrillator arrives, or until more advanced help arrives, like paramedics, doctors, something like that, until it becomes too dangerous to continue, or if you become too exhausted. Yeah.
Can I have a go?
Yes, of course. Do you want me to
Can I
hold?
hold that?
Yeah, of course. Yeah.
So, how many compressions?
So you need to do 30 compressions.
So here.
Yeah. So you would kind of straighten. Yeah.
Just put it here. Yeah.
Right. So try to keep your arms straight. Yep. And compress with your whole chest. There we go. Stay alive. Stay alive.
I've lost count.
That's fine.
That's about 30.
Yeah, I would say. So now, you don't have to do it. Actually, you can just show me how you would tilt the head. Yeah, and make sure to pinch their nose and open their mouth. And yeah, exactly. Yeah.
Okay. That's great.
Cool.
Thank you very much for showing us some CPR today. That's fantastic.
No worries at all.
Hopefully I won't ever use it, but we'll see.